You are watching the Doctalk show.
Welcome back. In today's discussion, STDs are the center of attention with lots of controversies and speculations around it. So I want to know from our guest doctors, what are the common types of STDs that the community suffers from? Dr. Sematimba, do you want to start us off on this?
We don't have so many that cause ulcers, but they are there. But commonly, the ones that cause ulcers in our setting include herpes simplex, which is caused by herpes simplex virus, usually type 2. And it causes a painful ulcer.
They're usually very painful, almost like blisters.
Exactly. Yes. It's painful.
And they keep coming and going.
Exactly.
They never cure.
I'm telling you, it's very painful. People who have suffered from those ulcers will tell you the story that it's painful.
Those are they call the genital ulcers.
Exactly.
Right.
Yes.
So herpes simplex causing genital ulcers.
Yes. So there are others like human papillomavirus, which causes warts. These warts appear like flowers, like dirty flowers. Yeah, they can cover the whole genital tract system, the external part, and it's not nice. Not
a pleasing
oh
sight.
my God! When you see it, you don't. And the problem is usually because of the location of the wart. He will tell you that most women come covering themselves and they are scared of showing you what they have, but we can help. And also we have syphilis. This is known to almost everyone. Syphilis causes a painless ulcer. It's painless. That's why.
But it's kind of fresh and like it has.
Exactly. It's elevated.
It's like a real wound with water coming up, but no pain.
When you see the edges, they are elevated like this. So, but it's not painful. That's why the community usually, the people ignore because they're not painful. They can continue with their daily activities.
A very common thing that I think most African societies think if there's no pain, probably it's not a sickness.
Exactly.
So syphilis is one of the, I think it's the only STD which causes painless ulcers. If I'm right. The others are probably painful. So Dr. Chigundu, apart from the ulcers, there's the other side, the discharges, which I think are the biggest majority. What are these common infections that cause the discharges, which are STDs?
We've mentioned Candida as one of them, but it's largely not an STD. Then you have other causes of discharges, which are really STDs, meaning they're sexually transmitted, especially chlamydia. Chlamydia is very, very common in the population, though it is underestimated, but it is one of the biggest causes of discharges, especially in men. Most common cause of urethral erosion and discharges in men. And then you have gonorrhea. Gonorrhea has not gone away.
Those two kind of go together, gonorrhea and chlamydia.
Yes.
Even in the treatments, they kind of treat both together.
Yes, exactly. Gonorrhea is kind of more aggressive than chlamydia, and we used to call it Obulwadde. It was a disease of strong men. Meaning that a man who had more than one woman was seen in society as so gonorrhea and syphilis somehow. If an ancient man didn't have gonorrhea or syphilis, was never suffered from gonorrhea, I would say you are not a yeah, but it is a very aggressive infection, and if a man has intercourse with a woman, within a week, they will start dripping. It's associated with aggressive erosion of the urine tract and then formation of thick pus, which will be seen. A man with gonorrhea will scream in the next urine.
So it is a painful discharge.
Painful discharge causes pain passing in urine. Unfortunately, in women, gonorrhea does not give symptoms.
Though in men they may say I'm itching. They may not describe pain, but they may say itching.
They actually mean pain.
Yes, exactly.
But in women, there is no pain.
In women, gonorrhea goes for the cervix, and it eats around the cervix, causes what we call cervicitis. So if you're not very keen, you might not diagnose it quite easily and quite early.
So in women, what will it cause?
And it causes cervix. First, it's around the cervix, and then quickly ascends into the uterus, the tubes. It causes aggressive destruction of the tubes, and it's the #1 cause of very bad PIDs and tube obstruction, tubal blockage, and infertility in females. So
this is what they call the blocked tubes,
yes.
Is it?
Most times when we by the time we get to realize that it's gonorrhea, it has already caused havoc, caused damage that is irreversible.
Okay, so it's quite an aggressive infection.
Yeah.
Yes.
In medical terms, we say it's usually the acute form. It's acute. It causes aggressive erosion of most of those epithelial surfaces, and usually things have gone wrong.
Okay, so now that we know the the most common examples of these STDs, I guess the next step is how one can tell. Can you tell that this is a discharge of gonorrhea, this is a discharge of maybe chlamydia, this is a discharge of no candida? What is the difference in those discharges?
Well, it's something we didn't mention. It's called trichomonas.
It's another
it's also some kind of protozoa, which is also another very common STD actually, which can have the same sequelae like others we have mentioned, chlamydia and gonorrhea. Yeah. So to your question, these discharges are actually different.
Discharges.
They are different actually. You can tell, and most cases we can even treat without actually taking off a sample test, because sometimes they are so obvious that this is this. They will take the line and it's
so
very clear.
How can people know that this is gonorrhea? They should take it so serious and run for the treatment.
The easy thing is to, of course, it's quite difficult for women to know that they have gonorrhea. Sometimes they'll have acute low abdominal pain with a bit of fever, joint pains, but it doesn't necessarily cause a discharge. That's why it is treated as other, as UTI or any other problems. But with a man, when a man has gonorrhea, most times they will not survive for more than 3 or 4 days. The problem is they will not mention. They will treat secretly and transmit it to their partners. So the easy thing is to say, if a man has gonorrhea or sees signs of passing painful urine or flowing whitish discharge through the privates, you have to treat quickly, treat the partners, and try to make sure you don't transmit it to a generation. Otherwise, it's a very aggressive infection. It's actually one of the most common causes of tubal blockage.
Yeah. So we mentioned that these discharges can be, you can tell. For example, if someone has a greenish yellow discharge, greenish yellow, and foul smelling, it could be, most likely it's trichomonas. It can be frothy, green and yellow, between green and yellow, trichomonas. Okay. Yes. We said candida is like caddy, spoiled milk.
Spoiled milk.
Yes.
And very itchy.
Yes, exactly.
Then gonorrhea is very painful in men, painful discharge.
Yes.
Or in women it can cause some sort of symptoms.
Again, gonorrhea because it can cause cervicitis. Someone can come with a pink, brownish discharge, can be pinkish. Someone may think, well, it's blood. I don't know. So because that's why some people ignore it, because it can come like
it's not so severe in women.
Yes.
So it can be ignored and
exactly. Or sometimes can be actually colorless and foul smelling.
So basically, what people should do, if they have any sort of, for example, if it's ladies, any change in the color, volume, or smell, they quickly go to the doctor.
That's the most important. Yes.
So in women, it may be hard to tell what gonorrhea is from chlamydia. In men, it's almost straightforward. Pain with a discharge equals gonorrhea.
The other thing that we should not forget and not go and mention is the issue of bloody discharges. They are discharges which are not spontaneous. They are sometimes discharges which are provoked by sexual intercourse. You have a brownish, bloody, or blackish discharge. Usually these discharges signify bleeding from somewhere. And then any discharge in a woman above 45 or in a woman in menopause should be taken much more seriously, because most times these discharges signify cancer of the cervix, of the vagina, or the uterus. Okay. So discharges above 45 or discharges in a menopausal woman, a woman who stopped menstruating, should be taken seriously. Okay. Because they are not usually innocent.
All right. So more about these discharges and STDs coming right after the break. We'll be right back shortly. If you have any questions or comments regarding discharges or genital ulcers, wounds, how you can tell these two apart, you can just send them on our social media platforms, Facebook and Twitter. I'll be so happy to respond to each of your queries. Don't go away. We'll be right back.
You are watching the Doctalk Show.